Hello everyone, you are all welcome to lecture number 1203, and today's topic is cardiophobia, or the other name we can say that heart anxiety or fear of heart attack. That is, I call it mental noise. And you will be surprised to know that today in India there are 300 million people. They are suffering from this type of, I call it mental disorder, anxiety. In Nigeria, it's around 200,000 people. They are suffering from cardiophobia. Actually, phobia is fear. And cardiophobia means the fear of getting heart attack and death. And it is happening because of one condition, and that is mental. But the problem is that all of us are not understanding our health, our reactions, our neurotransmitters, neurochemicals. That's why I used to say always, surgeons, cardiac surgeons, they are very fine artists in grafting. They can do very good grafting, they can remove one vein and give the bypass, all this they can do. But what type of reaction is going on inside, and because of that reaction, lot of cardiac problem is coming, enzyme, hormones, anxiety, these disorders, cardiologists, they are not understanding very well. And today in the world, 30% global population, they are visiting cardiologists because of cardiophobia. So once they feel that they are going to die, and there will be anxiety built up. And let me give you my example. Some few years ago, I was sitting in my drawing room with my one colleague, my neighbor in Nigeria. And all of a sudden, I felt that I am having shortening of breath or some chest heaviness. So it came to my mind immediately that there may be some cardiac problem. I told my friend who was just sitting side by me that, Professor Sharif, it looks like that I have some cardiac problem. He immediately phoned to cardiologist. In 1 minute, cardiologist asked one question from him. Is he talking to you? Is he sitting? He said, yes, because forget it. It's anxiety. This is the fact I am telling you. So some doctors who are very experienced, they understand, and in hospitals, now statistical data is there, I have gone through it. 80% cases, they are suffering from cardiophobia, heart anxiety, or fear of heart attack. Because once they get any pain around the chest, around the neck, around the hand, first they will think that it may be some problem of heart, or any palpitation, very fast heart beating, all these symptoms, they think like that. The first thing that if suppose such symptoms are coming to anybody, there are two conditions. First, go for investigation. Do all the biochemical reaction, cholesterol, triglycerides, HDL, LDL, go for angiography, go for ECG, go for echocardiogram, all these parameters you check. Once it is normal, and after getting all reports normal, and still you are believing that you are getting chest pain, then it is because of your neurotransmitter problem, your mental health problem, mental disorder problem. It is not your cardiac problem. Even chest pain, neck pain, shoulder pains, that you can get because of autonomic nervous system. And this autonomic nervous system, they are responsible of controlling your blood pressure, controlling your digestive system, controlling your heartbeat, nervous system. So once there is anxiety built up, all these systems, your hormone, all are disturbed. Immediately there will be fall of serotonin, dopamine in your brain, that is called neurotransmitter chemicals that brings happiness. And you will be having mood disorder. You will be having depression. And once you have gone to that state, immediately your negative thoughts will start flooding in your brain that now you are going to die. And the third factor is that those people who are having this tendency of heart anxiety, that is heart phobia, cardiophobia, they are feeling that they have problem. Is just their feeling. So once they will hear anybody in neighbor, somebody got heart attack and he died, he passed away, maybe in young age, immediately big impact, again anxiety built up. But everybody's health condition, history of health is different. Everybody's physiology, biochemistry, everything is different. How you are relating yourself that somebody, some neighbor is or some close relative passed away because of cardiac arrest or heart attack, immediately you may get. This is phobia. And the other factor, how to control it. First thing is that, which is very important for children as well as for old people, hydration. Once you are dehydrated, dehydration brings lot of mental complication. Take 2 glasses of water. Your anxiety will be up to certain level suppressed. And especially in old age, this type of dehydration and the anxiety out of dehydration is very dangerous. Dehydration, even in children, is dangerous because they will not tell and their cells are dehydrated. But for children at least, family support is there. Mother, father, sister, they are there, they will give the water. But those who are above the age of 60 and 70 is very serious condition, that is dehydration, and that dehydration is the mother of depression and anxiety built up in brain. The reason is that after the age of 60 we are all fluid. We are neither solid nor liquid, in between, because our body contains more than 60% water. So if in our body cells, if the water is reduced, immediately lot of complication will come. And that complication will be received by your brain cells. So the first condition to get the anxiety and fear, or we can say cardiophobia, fear of heart, first thing, hydrate. Dehydration is very chronic for anxiety and all these things. Second, sound sleep. If you are missing sleep, again there is maximum chance of getting anxiety. And one anxiety which is related to general, that is called the normal type of anxiety, and the one anxiety where your brain starts thinking that it is because of cardiac problem you are having here and there pain. And if the pain is there in your chest, muscular pain, so many other factors are there because of anxiety, because of muscular, because of some other injury, you will immediately think that those who are suffering from cardiophobia, that it is because of cardiac problem. So don't compromise your sleep, be hydrated, move with positive people, who are talking about the future, about the hope. Don't sit with the people who are having negative thinking, always talking about somebody died today, somebody died some 10 years ago, and somebody, I'm going to attend the burial, all always negative thinking. No. You should have cognitive therapy where you can, I can say, replace with the help of cognitive therapy your negative thoughts with positive thoughts, and that cognitive therapy is very effective for such type of patients. And also, what you have to see, which is very important, if you are sleeping and after sleep if you are getting, you are good. If you are taking water, you are good. If you are talking, is normal. So it indicates that whatever pain you are having, once you are busy, when you are writing, when you are playing, or when you are sleeping and when you are getting up, pain is suppressed and your brain is okay. The moment you are not busy, again it may appear. So that is clear indication that it is not cardiac. The reason is that cardiac pain or angina pain will remain whatever circumstances or condition is coming. Whether you are sitting, whether you are working, whether you are moving, whether you are sleeping, it can appear and disappear. So that is also one of the factors in order to make you stable and confident. So I have given these 10 points to discuss. There are two types of anxiety. One is called heart anxiety, other one is called general anxiety. And that heart anxiety means fear of heart attack is called cardiophobia. So number one, cardiophobia and hypochondria. There is difference in these two terms. Cardiophobia means it is related to heart attack fear. And then hypochondria. Hypochondria is a type of anxiety where always you are in fear. Let me tell in my Hindi language, Indian language. इसमें यह है कि भाई दो टाइप की दहशत है आपके पास. एक तो दहशत है आपके हार्ट अटैक की, जिसको हम कार्डियोफोबिया कहते हैं, एक मेंटल डिसऑर्डर है. और दूसरा जो दहशत है जिसको हम हाइपोकॉन्ड्रिया कहते हैं. हाइपोकॉन्ड्रिया में कोई भी काम आप करने चलेंगे, दहशत कि साहब वो स्कूल में एडमिशन कराया जा रहा है, कहीं फेल ना हो जाए, एरोप्लेन से जा रहे हैं, दहशत आ गया कहीं एरोप्लेन न गिर जाए, तो पता चला वहाँ पे आपका काउंसलिंग हो रहा है. सो इज अ टाइप ऑफ जनरल fear that is called hypochondria. What I have explained in Indian language means the general type of anxiety built up means you are going to airport to catch the flight. Sometimes you have the fear or anxiety that there may not be some accident, and at airport you are sweating. So there is counseling room. There are some head of the states, they are not traveling at all by air. They go only by train. From Korea to China, out of anxiety and fear. So these are all very, very negative aspect of anxiety built up. Mainly two types is there. The one which is related to your heart and cardiac problem, that is called cardiophobia. Phobia means dahshat, fear. And hypochondria means that is general type of anxiety built up. Number two, autonomic nervous system. Actually, once you have anxiety, your autonomic nervous system is weak and disturbed. And this your autonomic nervous system is controlling your blood pressure, your heartbeat, palpitation, all these things. And if you have anxiety, it will collapse your autonomic nervous system and you may get even pain. You will be totally confused and you will rush to doctor because of the failure of autonomic nervous system. Number three, cognitive behavior therapy, cognitive CBT. Cognitive behavior system is the most effective to treat cardiophobia and also hypochondria. But it is more effective to treat in general the build-up of anxiety and depression because of negative thought process, and it is very difficult for you to come out of that. So this therapy they are using, so that they are expert in that therapy. Nowadays thousands of the people, they are expert in this mental disorder therapy, and they will treat you properly with very good behavior and good attitude and some good scene and lot of things. So in that case, your anxiety will be suppressed and you will be having slowly positive behavior and positive thinking. That is called cognitive behavior therapy, CBT. Number 4, 30% people globally, is a big number, are visiting to cardiologists out of cardiophobia. Nowadays it is just like disease. It's symptom out of fear of death. And in this there is contribution of 3 ingredients also: online, YouTube, WhatsApp and internet. So lot of mental noise you are receiving. Mr. X died because of this, Mr. Y died because of this, Mr. Z just fell down. Lot of news every moment is flooding. Keep away. Everybody's condition is different. Socioeconomic or health, all. They are all different. Then 30% people who are visiting doctors due to cardiophobia, telling doctors having symptoms of cardiac, CARDI, cardiac pain, chest pain, shoulder pain, and they are non-cardiac. All the pain what they are telling to doctors, and it is their feeling. 30% people who are visiting, that they have cardiac pain, they have pain here, they have pain here, they are just center of this. It's all because of the failure of that is autonomic nervous system, because of your anxiety. Number 5, all people are having different medical history. So please don't allow such type of mental noise to come to your brain and stay. And you are thinking that you are the next one to go and die out of heart attack. That is cardiophobia. You are responsible for that. Death is certain. Why to fear? According to Genghis Khan, if you are doing something, don't fear. If you are fearing, don't do. But if you are doing, be fearless. You are going to do lot of things where risks are involved, and fear will kill you. Anxiety will kill you. Depression will kill you. So please be free. And all people have this medical history. No need to fear death due to heart attack, because everybody is having their own history. Number 6, negative pattern of cardiophobia. Some people will be having always negative pattern. It has gone deep inside their thought process that he is going to die out of heart attack. That anxiety built up will always be there. Whatever you are doing, they are depressed. They are always thinking that this is next time is my number. So in that case, sometimes emergency comes. You have to admit in hospital to make sure that he is confident that no, you are not going to die out of heart attack. It is only your anxiety and fear. It has gone up to that extent in this modern society. That's why this word has come that is called cardiophobia. Before we were hearing of only religious Islamophobia, but now it is cardiophobia. That fear has come to your heart attack. Number 7, if after sleep you feel good, after sound sleep of 8 hours, I have already told you, you feel good, you are talking normally, busy in your some work, there is no cardiac problem. you are okay, because after sleep your all anxiety is totally suppressed. Anxiety build-up will start when you will start bringing lot of negative thinking. So once you have all these things, you are okay. Number 8, serotonin can boost your happiness and mood because it is neurotransmitter. So in that condition, the doctor or cardiologist, they will prescribe some relaxant so that in your brain you are having such neurochemicals which can boost your happiness, your mood, and the best chemical substance is serotonin. Once serotonin level is normal, at least anxiety built up will not be there much. So discuss with doctor, and then you can take every day some 25 mg of serotonin. Number 9, exercise and quality sleep. I have already told you, exercise and quality sleep for 8 hours is very, very important, and to get rid of symptoms of cardiophobia, and then keep the company of positive, educated people who can understand you and your behavior. And in the last but not least, be hydrated. Dehydration, especially for senior citizens, is very dangerous. It will first bring your cardiophobia, anxiety, and after that, pain in any part of the body, in chest or hand or anywhere. First is dehydration. So please be hydrated always. So as a medicinal chemist, in one sentence, I can say that all these health conditions or problems are due to chemical reaction, due to lifestyle. Our lifestyle covers all these factors, and most of your 90% health issue is related to your lifestyle problem, and you just correct it, automatically you will be okay. So with this, I will stop. Thank you very much for watching the lecture.